Vioxx is a terrible tragedy and a profound regulatory failure. I would argue that the FDA as currently configured is incapable of protecting America against another Vioxx. We are virtually defenseless. It is important that this committee and the American people understand that what happened with Vioxx is really a symptom of something far more dangerous to the safety of the American people. Simply put, FDA and the Center for Drug Evaluation and Research are broken. Since November, when I appeared before the Senate Finance Committee and announced to the world that FDA was incapable of protecting America from unsafe drugs or from another Vioxx, very little has changed on the surface, and substantively nothing has changed. We're faced with what may be the single greatest drug safety catastrophe in the history of this country. I strongly believe that this should have been, and largely could have been, avoided, but it wasn't. And over 100,000 Americans have paid dearly for this failure. In my opinion, the FDA has let the American people down. I believe that FDA is unduly influenced by industry, and that undue influence is in part the result of industry money funding FDA operations.
There's an epidemic in the United States, one that has been missed by the mainstream media. In fact, there's no congressional hearings on it. There's no major effort to challenge it or change it. I'm talking about the epidemic of preventable diseases in the United States. Imagine this, 131 million overweight Americans, many of them toddlers and young children. We have an epidemic of diabetes, heart disease, arthritis, fibromyalgia, depression, anxiety disorders, environmental diseases. How did we get so sick? And why, after spending $2 trillion and over 700,000 physicians, over 2 million people in the health field, out of all of our hospitals and medications and medical procedures, why aren't we closer to eliminating these illnesses? I'm Gary Null. In this original, in-depth investigative report on over-medicating Americans, we're going to be asking some hard questions about where's this money going? Who is leading our healthcare crisis campaign? Are we spending any energy and money and resources on preventing these conditions? You turn on television, all you see are ads for either medications if you're sick or products that can make you sick, and especially the children. How did we get here? What can we do to challenge this? That's what we're going to explore. Join me now for this special look at our crisis in healthcare in the United States.
One of the pieces that I wrote for the British Medical Journal recently was about drug company influence at the FDA. And so the front cover of the British Medical Journal had the question, who owns the FDA? The drug industry or the people? To be raising such a question in one of the world's most senior medical journals shows that there is a massive crisis of legitimacy at the FDA.
The major issue Americans confront today is the fact that the FDA acts to protect the financial interests of the pharmaceutical industry as opposed to the health of the American public.
Within the Center for Drug Evaluation and Research, about 80% of the resources are geared towards the approval of new drugs, and 20% is for everything else. Drug safety is about 5%. Congress has created that structure by PDUFA, the Prescription Drug User Fee Act, by which drug companies pay money to FDA so that FDA will review and approve its drugs. For industry, every day that a drug is held up from being marketed, in their minds, that's another $1 to $2 million of profit that they're being denied. And so the incentive is really review the drugs as quickly as possible, approve them as quickly as possible, and don't stand in the way of our making profit. And FDA cooperates with that mandate.
The